The nanoporous acupuncture needle. Little known, porous needles have their physiological effects increased when compared to normal needles. Such needles are produced through a process of anodizing normal needles. In this process, there is a micrometer scale corrosion of the surface of the needles. The electron microscopy images of the porous needles shows burrs and micrometric tips, which, due to the power of the tips, accumulate even more electrons on their surface, increasing the physiological stimulus. And the blue laser. Another method for applying acupuncture is laser. The use of laser is recommended for children or people who are afraid of using needles. However, we must take important care when choosing the light used and the treatment to be carried out. We must first pay attention to using only in cases when the intention is peripheral sensory stimulation. The laser is capable of causing a displacement of electrons on the surface of the skin, and these electrons will cause nervous stimulus. Another important factor to consider, more than important, is essential. The laser must be blue, the color blue, the frequency of the blue laser. Due to the inherent characteristics of the electron, only light at the blue frequency is capable of boosting an electron to the point of displacing it and generating electrical stimulus. The use of other frequency, other colors, is not capable of boosting the electron, no matter how powerful the laser is. While the laser at the blue frequency will always be able to displace an electron, regardless of its intensity. I personally do not use this method in acupuncture. Biological factors of the skin makes the laser stimulus very irregular and sensorial effect uncertain. But I will talk about the electroacupuncture. I must recognize that this is my method of excellence. The electrical stimulation of the needles makes the physiological effects greatly amplified. When we apply electric current to the needles, we are saturating them with extra electrons and not just with the ions present in our body. It works as follows. For every two needles inserted, we connect two poles of an electrical stimulator, the negative pole in one and the positive pole in another needle. We apply electrical stimulus to them, and the electrical current will pass through the area of our body between the two needles. In addition to accumulating a huge amount of electrons at the tips of the needles, we will be creating a flow of electrons between the two needles. This flow provides a cloud of electrical attraction in the region of the body between the stimulated needles. In addition to the increasing the power of local sensory stimulation, it creates an area of electron attraction that is important for treating muscle pain. We'll see soon. Diseases and treatments will be able to heal. Muscle aches. With the concept of the electroacupuncture fresh in mind, let's start with the treatment of muscle pain. To begin with, we need to understand the etiology of muscle pain, and then this also applies to cramps, stiff necks, low back pain, etc. It's also important to bring in the Eastern concepts of energy node and ashi point. Theoretically, traditional Chinese medicine considers that our physical body has channels through which vital energy circulates. In case of illness, the circulation of this energy stops, causing knots, pain, discomfort. To balance the flow of energy is the intention of the acupuncture. Ashi points are the pain points, or the knots that we identify when palpating the skin and muscle. These points must be treated needledly in order to undo the blockage that prevents the circulation of energy. Cramps, torticollis, the famous sciatica, the famous lumbar back pain are cases of extreme stagnation of the free circulation of energy. Physiologically speaking, these are contracted muscle fibers that have not returned to the relaxation mode.